Assalamu alaikum, the communication date. First scenario, you are the registrar in the medical ward. Patient name Miss Bridge, 70 years old. Miss Bridge presented to the emergency department with headache, a very severe type of headache. Her blood tests were sent to the lab for ESR. In the emergency, she was prescribed with injection steroids with heavy doses to prevent her from blindness. Report of biopsy for the temporal arteritis came out as negative. Patient has developed steroid-induced psychosis. Patient is shifted to the medical ward immediately for further management. The task is to talk to Miss Raya, patient's daughter, tell her about the whole situation and manage her concerns. So you're ready, Dr. Ayula? If you're ready, we can start.
Sorry, I'm muted. I'm ready.
No worries. Here you go.
Yep. Hello.
Hello.
Yeah, my name is Dr. Ayola. I'm one of the doctors here on the medical ward. Can I confirm your name and your relationship with my patient, please? With the patient, please.
I am Raya. I am the daughter of the Miss Bridget.
Okay. Can you confirm Miss Bridge's age, please?
70 years.
70 years. All right. Thanks for coming to speak with us today, Ria. Miss Ria. I today want to discuss about your mother's health. I mean, some type of things that has happened since it has been on she has been with us. Is that okay to discuss, Ria?
Yes, I came for that, doctor.
All right. Okay. So before we start this conversation, is it okay if I ask you to tell me what you know about your mother's health so that I can know where to really start from? Is that okay?
My mother, okay. My mother, she's old woman. She complained only headache, and she came to the ER, and they give her some medication. I don't know. I think by mistake. My mother now she's not, she's not conscious. She not know me. She not my husband. What is this? She came only with headache, and now she is suffering more. I think you give her medication wrong.
Miss Ria, I can only imagine what's is been going what is going on with you right now. I've been to see your mother in this situation. Okay, but first I must commend you for bringing your mom to the hospital when she had headache. That was the right thing to have done. And I'm sorry that you feel the way you felt. But is it okay if I have some conversations with you to tell you exactly what happened, and then I can explain things to you in details? Is that okay?
Okay, doctor.
Yeah, when Mrs. Bridge, which is your mother, came to the hospital, she came with a very severe headache, a very bad headache. And usually when things like this happen, when we see things like, especially for women in our age, with this type of serious headache, one of the things that we do is to do some special tests in the lab to see if there's any form of reasons. I mean, if there are reasons why she have this headache, which we are doing. We've sent the test to the laboratory for her. And also, there was a particular diagnosis. I mean, there was a particular. There was a particular cause of this headache that was really put on top of that was really more the reason why we think she might be having this kind of headache, and is a form of a condition in which the body is trying to fight against itself. And we usually do a special nip for such patients to look at the blood vessels, which we have done in your mother. Though this result came back came back negative, but that does not still says that she does not have the disease, because that happens sometimes. And when we think about, do you follow
You
me,
mean
Mrs.
you give
Ria?
her, sorry, doctora. You mean you give her the wrong medication for wrong diagnosis? That's right, doctora.
Okay, Mrs. Ria. I quite appreciate you expressing these feelings to me, but I want to reassure you that she did not get the wrong medication for the wrong diagnosis. What she had at that point was highly suggestive of the diagnosis, and the investigation that we did, though negative, has not says that she does not necessarily say that she does not have the result. I mean, the that kind of, I mean, that kind of condition, the disease. But however, what we usually do is to give people with with such diagnosis a high dose of steroid, because one of the things that we are afraid for is blindness, and if this happens, is usually irreversible. So we give them steroids to prevent this from happening, usually a high dose of steroid. And before we start steroid, we talk about the possible side effects. And what your mother is having right now, I'm so sorry that you have to see her in this situation, but it's possibly one of the known side effects of the high dose of steroid, and is not that your mother, Mrs. Bridge, which is your mom, was given the wrong treatment. We have given her the appropriate treatment for the kind of presentation that she has come with and the kind of diagnosis that she's likely having. Are you with me, Miss Ria?
Yes, I want to ask you, doctora, she not know me now. She have a stroke now?
Well, from all Mrs. Ria, is there a reason why you think she's having stroke? Hello?
Yes.
Is there a reason why you
She
think she's
not
having stroke?
recognized me. She
Okay.
not recognized me. She is anxious. What is this? Only headache. She complain headache.
Oh, I can see that this is a difficult time for you, Mrs. Ria. And having to say your mom does not recognize you can be quite stressful. But I can say to you that from all what we've examined her and we've checked her, she's not likely she's not having stroke. What she have has been caused by the medication that she's using. Is one of the side effects of the medication, and this might affect her behavior. She might not be able to recognize people for now, and she might be acting in some form of aggressive or some form of behavior that is not usually known of her. But not to worry, we are currently monitoring her. We've moved her to the medical ward where she'll be closely monitored, and we would continue to manage her. We'll also ask for support. We will stop the steroid, okay, because that has possibly caused out this. Then we will invite other other doctors, especially the doctors that take care of behavioral condition like this. We will invite them to come and have a look and then give us advice on possible way to manage her. How does that make you feel, Mrs. Ria?
There is a treatment for her, doctora?
Well, if I may ask, do you mean in terms of the behavior that she's having now? Hello?
Yes.
Okay.
Yes.
Well, for now, we could just continue to monitor her, and
Two
then
minutes left.
we will invite the behavioral doctor to come and assess her, and possibly commence her if there is need of possible commence her on medication that will help her to calm her down, and then help with this behavioral um, s- um, um, these behavioral symptoms that she's having.
She will improve, doctora.
But she will improve. Once we stop the steroid, she will improve.
When? How much time she need?
Well, right now I'm not quite sure how long it will take, but usually in a couple of I'm not quite sure how it take. I can as well check that up to you, and then we can discuss this at a later time. Is that all right? Have you got any further question, Miss Ria? Hello, Miss Ria. Hello.
Yes, we can hear you, Dr. Ayula. Waiting for Dr. Huda. Maybe
Okay.
it's connection problem. I
Okay.
put the timer already.
Yes.
Yeah, Dr. Huda, you're back. So you can continue.
And so yes.
I said, does that sound like a plan to you? And hello, Miss Ria.
Yes.
I was just saying that we'll continue to monitor her, and about the time that it will take to come out of this, I'm not quite sure right now, but I'm going to look that up, and also then we can have a further discussion about that. Is that all right?
Okay.
Okay. Have you got any
Okay,
further
doctor.
question, Mrs. Ria?
But sure, this is not a mistake.
But this is not a mistake that has happened. I know it's difficult for you seeing your mom in the current situation, but it is not a mistake. It's one of the a known side effect of steroid that has happened.
Okay.
Okay.
Okay, you will give her full attention in the hospital.
Is that what?
Yeah, she
You
needs
will
more
give her
attention for her
full
mother.
care in the hospital.
Okay. She
Honestly,
will. Yeah, she will give more attention to her mother.
yeah.
Okay.
We'll
One
continue to
question.
monitor her and monitor her on the ward.
Yeah, perfect. Okay, I will add some seconds, 20 seconds, for example, to ask more time, to ask more question because the time was, I think there was lagging. So you can
Mhm.
start 20
Okay.
seconds. What you
All
would
right,
ask?
Mrs. Ria. So how are you coping with your mother's condition right now? Taking care of your mom? Hello?
What you say?
I mean, how has this taking care of your mom? How has it been? How has it been thus far for you?
I don't understand what you
Who's
say.
looking after your
Sorry.
mother at home? Who's looking after
Me,
here?
Okay, and
me,
how has it
doctor.
been for you in terms of has it affected you in any way?
No.
Okay, so if you need any support whatsoever, please do let us know, and we would direct you to where to get
Thank
such
you.
support. Is that okay?
Okay,
Oh,
but thank
Okay.
you.
all right,
Okay.
thank you so much.
Perfect, Dr. Ayola. Well done. Let's start. Dr. Oda, comment, please.
She's good, really. She tolerated the angry patient. But about the treatment, she give her. We not give any treatment medication, but we keep her in the quiet room, away from the noisy area. We will keep one nurse beside the patient to take care for her. We will monitor her vital sign only. But she's good, very good.
Yes. I agree also with Dr. Ayola answer. She said if she needs something to calm her down, we give her. So this is good answer and diplomatic way. I like the way Dr. Ayula did this performance of the scenario. She did great, really. She was tolerating the angry, as Dr. Roda said. She was calm. She know how to answer. Even when she asked Dr. Roda, ask about the possible medication, she didn't give her a name. So we will monitor her and we will call the assigned doctor or the specialist to attend and to look for her condition. If she needs any medication, he can give her in order to calm her down. So be smart while answering the concern. If you don't know the medication, even me, I don't know what the antipsychotic can give in steroid induced or psychosis induced by steroid. But it's good to say either we will call the doctor or I will ask my senior. I will have a meeting with you to arrange a meeting with you to discuss the possible way how to treat this. But Currently, we will isolate or we will put her in a side room. Some nurse or one nurse will be one to one with her, monitor her, try to calm her down. And what you have to invite in this scenario, Dr. Ayula, and you didn't do, to invite someone of her family member to stay with her in
Mhm.
order to regain her awareness within her family member. So she will not be surprised who's around will be someone stranger, right? So
Mm.
she will feel it's at home. Sometimes also they can bring her tools or private tools from home, like her clock, her mirror, or something she used to see at home, or her
Mhm.
sound, radio, anything she used to listen or to use at home. You can bring it, or you can invite the family to bring, as well as some of the family member can stay with her in order to regain her awareness gradually without agitation. Why? Because once she will regain the awareness and she will find someone else, the nurse or anyone from the medical field who's not aware about them, she might get more nervous and agitation. That's why we can invite the family to stay with her longer time, or at least they can bring her tools to the hospital, private things. Otherwise, from the start, the only thing you miss the next of kin. Okay, you have to confirm is she the next of kin? Why? Because you are going to breach the confidentiality. You will talk about her condition without, of course, assuming there is a permission. Why? Because the patient already lost her capacity, right?
Mm. Mm.
So you no need to assume that we got a permission here, or you ask the patient to talk with the daughter. Why? Because the patient already lost her capacity. What's your expectation? And the background of the mother, she came with a headache. I'm so sorry for your suffering. And we give her the best interest of her condition in order to save her eyes or her vision or her sight. Why? We suspect something dangerous, which might lead to this. You mentioned vascular and some jargons. I prefer not to mention the vascular. So you can say some of the blood channels getting inflamed or soreness. And by this soreness, the vision might be lost.
Mm.
I'm afraid to say even this vision, if lost, it might be something permanently. And she might lose her vision permanently. In order to prevent that, we give her the steroid in high dose. This condition called, you didn't mention the name of the diagnosis at all, right? Be,
Yes.
be sure, whenever written in the scenario, you have to use it. Why they will write for you in the scenario that this patient possibly had temporal arthritis? You have to give the name to the patient daughter. So you will tell her, I'm afraid to say, in her condition, with her presentation, she might have a condition called temporal arthritis or giant cell arthritis. Have you ever heard about it? No, doctor. So in order to prevent the complication of this condition, we give the medication. It's not wrong medication. And the condition, you can define the condition, soreness in the blood channel of the eyes, okay? Or a blood channel in the face, and it might be supplying the eyes as well, and it might lead to the blindness. And unfortunately, this blindness, if happened, it might be permanently. I'm repeating
Mm.
because, yeah, you have to understand the condition and how to present and how to discuss this with the daughter or with the surrogate.
Mm.
Okay, so you have to talk about the whole situation from the pathology and the management and the complication. If she understands, it's okay. If not, and she is blaming you, still insisting, negotiating to make a complaint, it's again, you can reassure her that the condition or her mother condition will not be, or the care of her mother will not be affected, even if she will complain, and this is her right, and you can guide her to the PALS office. But in this scenario, she didn't insist, even she didn't ask. She just asked you, is it a mistake? And you answer her in good way. I can understand this is very difficult for you. It's your mother, and you're worried about your mother. But I'm assuring you, this is not a mistake. Any condition on any patient in your mother situation, we will give her the medication in the best interest of her condition. So try to mention the best interest
Mm.
in any scenario you suspect it is important or something life saving to give or to do for the patient. Okay? This is the whole scenario. So it's not a mistake, it's one of the complication. We will try to treat this complication by our teams. We invited the doctors, assigned doctors, the specialized nurse. We shift her or shift the patient to the aside room. You can bring someone to sit with her to regain her awareness in order to calm her down, all the things in the discussion. At the end, of course, you have to ask about who's living with your mother or who's helping or supporting your mother. Does she need any support at home? No, doctor, she's fine. Okay, do you need anything, any concern? No, doctor. This is the leaflet brochures about the condition that mom suspected before, and this is the leaflet brochures about the condition your mother suffering now. For example, steroid induced psychosis. Okay,
Mm.
is it clear, Dr. Ayula?
Yes, it is.
But you did it perfect. Just try to minimize the jargons or even use non-jargon or some simple way for the explanation. Okay? Blood channel, you can say the blood vessel or the vascular disease, you can say it's a disease of the blood channel. Inflammation, soreness in the blood channel that supply the eyes in order to prevent the blindness. Okay, always be simple and you can do it. But you have good way to convince, the good way to communicate, good and calm way to talk to angry patient or person. Okay?
Mm.
Okay. Any question, Dr. Ayula?
Okay, I'm just looking at the scenario that we're not given. Usually, I think that in a communication station, I was just like, okay, if we're not told how to know what is expected to be done for the patient, and you have a knowledge of what is expected, I mean, what is expected, and in terms of management, is it all right to say it like, okay, in this we're going to give you this, give you that, like in terms of treatment, since it's not like a treatment station, it's more like telling the patient what to expect, and people have said oftentimes that stick to what is being written in the scenario. Take for instance, in this scenario, it said further treatment for further management, but it was not specified what exactly. So is it expected of us to say things that normally would have been done for that kind of patient, or you just say that we'll continue to look after
Yes.
on the ward
Yeah.
and yeah.
Yeah, that's why I said the way you manage the management plan was perfect. But please be sure that you invited the assigned doctor. It's
Okay.
not, yeah, it's not your job to manage the side effect. It might be something related to another system which is not your specialty. You are the medical doctor now. How you will manage something related to the psychiatrist illness? It's not your task, right?
Mm,
So you will invite the assigned or specialized doctor as well as the nurse to stay with the patient and to manage her accordingly. So be sure that it would be the first option whenever any management plan asked by the examiner or asked by the surrogate. The first thing to mention is multidisciplinary team. But with the examiner, you will say multidisciplinary team. With the surrogate, you will say group of doctor.
okay.
Invite the most important team in each scenario. For example, in this scenario, we invite group of team or team of doctors or specialists, including the, for example, the mood doctor, right? Psychosis,
Mm,
or the specialized nurse. If you don't know the name of the team, just say we will invite the specialized doctor, specialized nurse. Okay? But in order not to be in trouble with the medication name, and you are forgetting the name of the medication, for example, you don't know how and what to start, and it's not mentioned in the scenario. They want to test your knowledge. You can say after inviting the doctor, they will prescribe for her the best interest of her condition. You didn't do the mistake, and you give her good answer, right? Always be smart while answering the concern. Our problem is always rushing to give the medication name. Whenever the surrogate asks, what you will give her, doctor, you will say, we will have a medication called. No, it's not a matter of medication. It's a matter how to manage the situation in general, not only the pharmacological. As we know, while discussing any long scenario, we start with patient education, counseling, multidisciplinary team approach, non-pharmacological and pharmacological at the end. You got it.
Mm.
You have other question?
No, thank you.
Perfect. Okay, you can prepare a scenario now for Dr. Huda.
Okay.
I will try to read the comments. Dr. Elaf, should we ask about smoking, alcohol, driving here at all? First thing, the patient still comatose or in psychosis. So what the benefit? Whenever she get or she regain her capacity, you can discuss with the patient. The second thing, the alcohol, of course, the same, alcohol and smoking. Try to minimize asking the things not related to the patient directly. So if you are sitting with the daughter, don't discuss smoking and alcohol for the father, unless it is direct harm to the lung. For example, patient is smoking and he has possibility of lung cancer, or he has TB, and the son is sitting with you. There is something should be discussed with the son related in direct harm to the lung. You can discuss the smoking. Or the other situation, if you finish the whole task, you don't have anything to discuss. You offer the support, you ask about the job, the impact on the job, the daily activity, everything you discuss. You don't have you have time still. You can discuss it like something complementary, not something essential. So don't leave the task and ask him if your father is smoking. No, let it at the end, maybe the last minute, even after offering the brochures, website leaflet. But if you are talking to the patient himself, immediately address it. Do you smoke? Do you drink alcohol? If there is problem with the drive of the eye or vision, do you drive? And of course, the job and the daily activity, how to do, how to cope with it. And the last thing, the job and the daily activity we mentioned, right? Daily activity and job. Do you smoke? Do you drink alcohol? Do you drive? Thank you, Dr. Elaf. The next comment, Dr. Patient, the name is Besa. I think this is a treatment of delirium and not psychosis. Acute confusional state. I think this is treatment of delirium. What I mentioned, the delirium, it's delirium or psychosis or acute confusional state. I didn't understand the question. You mean the things I mentioned or the scenario itself? Anyway, delirium or psychosis, both management. Psychotic patient mean he lost the behavior. Either he's in hyperactive behavior or hypoactive behavior, and you can treat him with the same management of delirium. The same delirium is the patient lost the awareness as well as the behavior. Okay, but the psychosis is related to the steroid per se. Delirium is related to certain condition, like for example, isolation in ICU or a patient admitted for long time in the hospital. But the same situation, patient here lost the capacity, lost the awareness, and the behavior changed. And the same management plan. You can bring his things, his tools, the same, because whenever he will regain his consciousness, he should find his family in front of him. Dr. Zoom, one mentor gave us this scenario as error because given in ER by a resident doctor. Okay, so let's have a deal for any scenario. You might have the scenario as medical error, and another situation, in another scenario, in another session, you might have the same scenario as complication. How to know this is complication? How to know this is an error? Always follow your sense. Do you think in this scenario there is a mistake? I don't think so. Patient already prescribed the steroid in the best interest to save her vision or her her eyes or her sight. In the second scenario you mentioned, I will tell you the scenario. Patient prescribed the steroid by the junior doctor, although the clinical suggestion and features of the patient doesn't look like she is in the GCA or giant cell arteritis. And the consultant, when he reviewed the labs, listen to this sentence because it's very important. When the consultant review her labs, review the image, he said or decided this is never ever to be giant cell arteritis and the steroid shouldn't be given at all. What do you think about this sentence? If the consultant said this medication shouldn't be given to the patient, do you think this is still complication or side effect? So this is the way how the other presentation of the same idea of the scenario but different concepts. Here it was prescribed in the best interest. In the other scenario, it was prescribed early before waiting for the consultant decision, before waiting for the result, and it wasn't clinically suggestive of giant cell arteritis. And the consultant himself saying it wouldn't be never as giant cell arteritis. So from the words in the scenario, you can know this is either the mistake and you follow the error mistake steps, or it is in the best interest and it was as side effect. BDD for both scenarios. So you can find the same idea, but with different concepts. Is it clear now? I hope it's clear for the one mentioned. One mentor, okay. Not logic, not written in the scenario that it is being given by resident. Yes, I agree. It will be also written. It wasn't given by the doctor or registrar or whosoever, but it was in the best interest. Always look for the word in the best interest. Whenever you find in the best interest, so this is not an error at all. Whenever you have a patient receive the medication wrongly, it will be clear, frankly. Sometimes they will write resident or junior doctor without prescribing by the consultant, or even during the discussion, the patient will tell you, no, it wasn't prescribed by the consultant. So you will feel, and always please follow your sense. Whenever you feel this is a scenario of error, do it as an error. And by the way, it will be clear in the words and in the paragraph, in the sentence of the scenario. But in this scenario, it wasn't an error at all. Okay, so your scenario, Dr. Huda, I hope you read it before because we discussed long time for the previous scenario. You are the medical registrar in the rheumatology outpatient clinic. Mrs. Patel, 52 years old lady who has a history of severe rheumatoid arthritis. She has tried several disease modifying drugs including methotrexate and anti-tumor necrosis factor (TNF) therapy without significant reduction in disease activity. She has come to see you in clinic today as you wish to start her therapy with rituximab. Discuss with Mrs. Battle on commencing rituximab and address her concern. Good scenario. We didn't discuss it before, or we discussed it since long time. If you're ready, Dr. Huda, let me know. And anyone
Yes,
who's
doctor.
you can start immediately.
Yes.
Okay, give me just a second to address this concern and this question. It's nice question. Should we tell stop steroid gradually and involve multisemial team approach? Be sure whenever you start the steroid within or less than three weeks. Okay, so you can stop it immediately if less than 3 weeks. Sometimes they mention the dose 7.5 for 3 weeks. If the patient started steroid 7.5 milligram daily or more for consecutive 3 weeks, you have to taper down the steroid. Otherwise, you can stop it abruptly. For example, in the septic shock patient, whenever we start the hydrocortisone and the patient blood pressure improve, less than 1 week, we can stop it. the same as in this scenario. He received one dose, or she received, for example, two doses. You can stop it abruptly. Anyway, if you are worried about this answer, you can say we will stop temporarily the medication until be seen by the assigned team or specialist, either to resume or to stop. However, in this scenario, it should be stopped. Okay. How explain psychosis? As Dr. Ayula said, the patient lost the capacity. She lost the awareness about the surrounding, the persons, as well as the behavior change. She's behaving differently now. Either she's hyperactive, aggressive, fighting, biting the nurse, or sometimes it could be hypoactive patient is lazy, sleepy, she's not talking at all, she's not responding, she's not reacting to anyone. So this is the psychosis simply. So the awareness plus the behavior change. So clear. Thank you. Okay, thank you, Dr. Bisi. Yeah, now you can start, Dr. Hoda and Dr. Ayuda. Ready?
Yes.
Yeah. Here.
Okay. Hello. Okay.
Hi.
Hello, I'm Dr. Huda. I'm Dr. Huda, one of the doctor of the clinic today. Are you Miss Battle, 52 years old?
Yes, doctor.
Nice to meet you, Miss Battle. We are here today to discuss some issue about your condition. It's okay with you?
Sure, doctor.
Okay, Miss Battle, you can tell me what you know about your case.
Okay, doctor, if you look through my record, you can see that I've been having arthritis, specifically rheumatoid arthritis, for some years now. I've read so much about this. I have a good knowledge about rheumatoid arthritis because I've suffered so
Yes,
much. And
yes.
over the years, I've tried different types of treatment, including steroids. It gave me side effects like thinning of my bone. I've tried another medication called methotrexate. It also affected my liver. I've tried another one called antitumor necrosis factor. I've read infliximab. Yeah, I've read so much about this disease. I didn't also tolerate this, and but my disease gets worse in every day. I work as a shop assistant, and I cannot
Oh,
do my job as I should. So I'm just wondering. I know that there's another medication I could try. I've read about it on the internet. So I'm here to discuss about it and see if you are happy to start me on this.
I'm sorry for that and for your suffering, Mrs. Battle. Okay, if you give me a chance, I will explain for you. As you know, the rheumatoid that you complain, it's a chronic disease and affect your joint and with the time increase the effect of this disease in your health, okay? For that, we started by medication. We started by the simple medication and we will see the response of the patient for this medication, okay?
Okay,
We
doctor.
try with you many medication. I'm sorry for that. And you suffering from the side effect of this medication. I'm sorry for your suffering. But when we give any medication, we must balance between the benefit and with the side effect for the medication. If the benefit more than the side effect, we must give you. Because you know the rheumatoid, it's destroyed your joint and you will suffering and make your life miserable. Okay, Miss Battle, because you not respond for the. You are with me, Mrs. Battle.
Yes, doctor, I'm with you.
Okay. Because you're still suffering and your case not improve. We trying to start with you medication. It's called biological medication. You hearing about this before?
Yes, doctor, I've read so much about options for the management of rheumatoid arthritis. I've read wide.
Okay. This is okay. This is type of medication, strong medication. It's decrease the defense mechanism of your body. Okay, that's meaning that not allowed for your body to attack own. Okay, for that they decrease the so in your joint, and like that will improve will decrease your suffering. Okay, this type of medication it's strong, and you know this because it's decrease the defense of the body. It can cause infection. You can have any bug, sorry, you can have bug infection. Okay, before we start this medication, we must do a lot of investigation for you. Okay, to assurance you are okay. We will check the liver function and renal. Okay, and also we check for the X-ray. We will do investigation for the bug infection, especially like TB. Okay, we prevent any side effect or any problem from this medication. It's okay with you, Miss Battle?
Yes, it's all right. I know this medication is quite expensive because I know it costs the NHS a lot of money. Doctor, do you think this medication will,
Also,
will really cure me? Do you think it will cure, looking at how expensive it is and every other thing that you've mentioned about it?
what you said?
I mean, will it cure the rheumatoid arthritis? Because I've
Yes.
suffered in love a lot.
I am sorry for that. I know you're suffering. For that, we choose this medication. Okay. And before we start any medication, we will do the investigation as I told you. And we will give this medication by the IV drip. We will connect it to IV. And the first time when you take this medication, we will give you slowly for many hours. Okay. After that, we can give you quickly. Maybe you have some side effect like reaction from the medication, but I want to assure you, you receive this medication under our observation. Okay, in the hospital, we will observe you and we will monitoring you under our care. Okay, and we will follow with you also by investigation in the clinic later. It's okay with you, Mr. Battle?
Yes, it's all right. It's okay, doctor.
Okay, you said you feel this medication very expensive. I'm sorry for that. I will try to help you. I will talk with the social worker and occupational if they can try to help you. Any another concern, Miss Battle?
Okay, I remember you spoke about the tuberculosis. At the time, my mom had a tuberculosis at that time, and I also had this lump in my neck, and it was checked, but I never got back from the doctors what exactly it is, but back at when I was back at home. So I'm just wondering that what if it's tuberculosis? Will it, and you also mentioned tuberculosis as one of the things that you will check for. Do you think I will not be able to get this treatment?
Yes. Thank you for your sharing this information with me, Miss Battle. I want to assure you, we not start this medication before check the bug infection of the TB. Okay, we will do first for you X-ray for the chest to assure there is no infection. Second, we will do blood test and also skin test. If we find you have this, you have this, we will refer you for the bug specialist. We will assess you if you have this infection, it's hidden or it's active. If hidden, we will start for you special medication for this bug infection, and maybe you will take only 1 month. Then we will start directly our medication, Rituximab. Okay,
Okay, Doctor.
it's okay with you, Miss?
Yeah, yeah, it's all right.
Yes.
It's all right. Thank you so much. Okay.
Okay, I want to ask you, Miss Battle, are you smoking?
No, no, I don't.
You drink alcohol?
No.
Okay, with who you live, Miss Battle?
I live with my husband and 2 children.
You need any financial support or
2 minutes left.
I don't. There's no.
you need any support, Miss?
No, but I'm just not happy about not being able to function well at work. And I'm wondering if
I'm sorry.
this treatment will cure this condition, this rheumatoid arthritis.
Okay, I'm sorry for that. I can try to help you. I will refer you for occupational department to try to help you. Any another concern, Miss Battle?
No. Thank you, doctor.
Okay. Miss Battle, I want to assure you we will follow with you. Okay, and I give you some number to contact with me, some brochure and website to read more if you want to know about this type of the biological treatment. Okay, and I want you also, if you suffering from any problem, anything, you can come directly to the ER. It's okay.
Yeah, thank you for that, doctor.
You have 30 seconds left. You want to ask, to address any concern? You want to offer something? You're going to give her some instruction about possible side effects in the future. If she feel unwell, what she should do. Any red flags, safety anything?
Sorry, sorry, doctor. The net not connected. Sorry.
No
Okay,
worries.
we
I'm
include
asking
more.
if you have something to give, like safety netting instructions, red flags.
Uh,
You want? You're satisfied?
sorry, what you said, Dr. Basim?
I'm asking you, do you want to give her some red flags? If she feels something in the future, she should ask medical advice or seek medical advice? What you can tell her?
Um, if she have fever at high temperature or
Perfect.
uh, fever or nausea, vomiting,
Feeling
she
unwell.
come back directly to the ER.
Simply,
Yes,
simply,
she come back to the ER.
yeah, simply, if you feel yourself unwell, okay, fever,
Yes,
and or you are unwell, okay, just visit us in the emergency,
yes, it's
particularly after the day of the or the biological therapy, okay, particularly the day after, because you will give her the medication, she will go home after the medication, because it's, I think, given every 6 months. If you feel like this the day after, so please don't hesitate to call us. That's it. Okay, well done, Dr. Rodha. Let's hear Dr. Ayula comment, then I will comment.
Well done, Dr. That it was a good presentation. Well done. You opened the conversation well. It was a good one. Just some one or two things that I think you may want to add for subsequent presentation. I mean, particularly this scenario. So, first, this patient is. I like the way you introduce the patient, you listen to the concern of, I mean, to the patient narrate her own side of the story. Okay. First, you need to let the patient know that this all the side effects of the treatment that she's had in the past. There are side effects, well documented side effects of the treatment. And it's not that she's had something out of the blue, something that is not common. Okay, is one of these things that are expected for the treatment. And if one is not, if she has developed side effect to one, we move to the another. And that is what has happened in her case, just to reassure her that is expected side effects of that. And then I've told you that I've read about this treatment. You may want to know what I know about the treatment, since I was just emphasizing that I've read about it. What do I know about it, and where exactly did I get my information from? At that point, it would have been a point to educate the patient that not everything on the internet are reliable, and there are some sites that are that give reliable information. And one of those, I think, we want to talk about maybe the NHS sites. If I don't know where you, sorry, I don't know where you practice. I'm so sorry. Depending on where you practice, the acceptable websites of that location. And then moving on, then you then start to talk about the treatment, which you did. You talk about the type of treatment, how it works, it modulates you talk about how it's damping the immune system and prevents the body from reacting to the joint, which is what is happening in rheumatoid arthritis. And you spoke about the side effect, how it is given by infusion. And then I asked a question that with this is quite expensive, will it cure me? Because I've read about that it's an expensive treatment. Will it cure? That question, that concern, you didn't really address that concern. Because my expectation might be high that since I'm going for this expensive treatment, will it cure me? At that point, you need to let me know that, oh, it's quite expensive. You understand that, but whether you are buying out of pocket or depending on what is available, you're buying out of pocket. If it's being supplied from the if it is supplied to that individual, so depending, just say, okay, I understand that it's expensive, but it's something that we give at this stage because you've had, well, you qualified for this type of treatment because you've not responded to the previous treatment, and this is the next one that we are moving on to. But I'm sorry to let you know that it will not cure, because if we cannot cure this condition, we can only manage it. And this will also improve your symptoms and possibly allow you to do your job more effective and as much as you want to do. Okay, I think that would answer the question of will it cure. Then you spoke about the potential side effects and the TB thing. You gave me a lot of information about the TB, a lot of information about tuberculosis, which I think I might not need. Okay, in terms of, because it's scary to me knowing all that my treatment will be stored 1 month. I have to wait with this kind of symptoms ongoing. I was just thinking that maybe something like okay, tuberculosis is one of the things that we check for before we start Rituximab. We do it for everybody, irrespective of whether you've had exposure to tuberculosis or not. So that will leave me like, okay, it's not because I've had exposure to my mom, tuberculosis, whether you have it or not, we check it for everybody. And because you've been on a particular type of treatment, that's the anti-tumor necrosis factor, which the patient knows what it is, which that the tuberculosis will have been checked as at then to know if you had it. Okay, but at this time, as you are starting this as well, if you have been given that treatment, possibly you don't have it. But at this time, we also recheck to see if you have it, and if you had it, we will manage it accordingly. And then, but that does not exclude you from taking the treatment once we are able to address tuberculosis. Okay, I think that may relieve me of getting fit. Just tell me that tuberculosis, we do it for everybody, not because you've had the exposure of the tuberculosis. I think is one of the myths of this conversation. The idea that I'm reading on internet, I might be reading junks and reassuring me that tuberculosis is one of the things that we do for everybody, irrespective of whether they've had exposure or not. Then information about Rituximab. You mentioned that you will signpost me to some websites, which is good. And then organize appointment again. You want to ask me that am I happy to start the treatment? Yes, then okay. If you are ready, then we can start doing the workup for you so that we can start the preparation of getting you started. Because of course, it's a treatment that you need consenting for this kind of treatment. So we will start doing the workup and then start preparing you for the treatment. So in the next appointment, we'll discuss the result of the investigation, and then we can take consent for the treatment. Is that okay? It's all right. Thank you. Leaflet and everything. Thank you. Okay. So thank you. Well done, Huda. It was nice presentation.
Yes, a nice scenario, Dr. Yola. Thank you for bringing this scenario today. Okay, I will start from the last comment. 52 years old, Dr. Hida. The patient age is 52 years. So the issue of pregnancy here will not be raised. If you have the young patient, yes, you
Yes.
can raise it, but it's not in this scenario. Okay, back to the performance. Dr. Hoda did great. I think the introduction, yes, it was good. Here, one of the stations or the situations you can invite someone to attend. Are you willing someone to or to invite someone to attend our meeting? You are Mrs. X, and I'm Dr. X. I'm here to discuss about your plan or about your health condition. I prefer to say I am one of the doctors here. I felt like you are hesitant. Which department you are in, Dr. Alhuda? So the best way I'm always advising, please say I am one of the doctors here. Whenever the position, whenever the department, you are one of the doctors here and I came to sit with you. So you will not be focusing on the department, your position, and you will not say wrong whenever you are saying I am the one of the doctors here. Please do it as a habit. Okay. Back to the introduction, the background, the expectation you ask, well, what do you think about what's ongoing? I think Dr. Ayula, as a surrogate, she gave you good introduction as well. She told you, I know everything about the disease. I know everything about the medication I used. Even when you offered here new medication called biological therapy, have you ever heard about it? She said, yes, doctor, I read about it in the internet. I think she shortened all the time to explain a lot of things for this medication. Yes, you're tasked to talk about it, but I believe you can ask her, what do you think about this medication would be good question in the beginning. Why? She will tell you a lot of concern she might raise. At the same time, you save the time to explain the medication use or side effect or whatsoever, because she will tell you some side effects she's concerned about. At this time, you already address the concern, and at the same time, you explain side effects. So please, whenever the patient is talking to you and he's telling to you, doctor, I don't want to start this medication. I read about this medication. I heard about this medication. Tell him, what do you think about this medication? No, doctor, I'm worried. It's something can lead to decrease defense system. Now you can start addressing the concern, plus in brackets you are explaining one of the side effect or the one of your task. So you save the time, you address the concern, and you explain the condition. Now the time for first concern. For example, if she said, no, doctor, I'm worried about my defense system might be weaker. You can, yes, address her concern. I appreciate your worry and I appreciate your knowledge about this medication. She read about it even before sitting with you. So you can appreciate that. I appreciate your reading and sharing this with me. Yes, Mrs. Battle, it's one of the medication can lead to decrease or weaken your defense system. But don't worry, we will follow you, we will monitor you, we will keep in touch with you. Everything will be monitored through our blood workup to be sure that you are not in the weak side. However, the mechanism or the way of this medication working is through the weakening your defense system in order to not to attack your joint. Yes, it would be in general you will be weak in your defense system. That's why we advise you to stay away from crowdness, stay away from any sick patient. If you are taking care of someone who's sick, please stay away. So you address the concern in the same way you explain one of the side effects, and you address the or you explain the way how to prevent the side effect. Okay, and you can convince her by the same way. It's very important to have weakened defense system, but not to the level of catching the infection easily. Yes, it would be somehow easy, but it would be something help your defense system not to attack your joint and to control the disease. Okay, so this is one of the important concerns and should be as a concern, in the same time should be as explanation of the side effects and how to prevent it. You have to give her some alarming not to stay with any sick patient. She might have her mother at home, and it came in a scenario before. I have a TB mother, and I am looking after her. What do you think, doctor? No, I appreciate your care about your mother. However, in your situation, it's not advice or it's not wise to take care of your mother right now. She might, or you might have, or you might catch the tuberculosis or the condition or the chest infection, whatsoever she has, the mother. That's why we advise you to be away in this duration. Okay. I think this is the most important thing in the scenario. Explain the mechanism of action and the side effect in the same time. Let's go to the other side effects, and Dr. Al Huda already mentioned. So we have to monitor your some bug infection in your body, including the tuberculosis, hepatitis B, infection to the liver, infection to the liver either by virus called virus B or virus C, as well as for the tuberculosis, HIV, I think also. So, in order not to have this infection inside your body and to be exaggerated later on because of this medication or activated later on because of this medication, we have to screen for them. Doctor, what if I have this condition in my body? We should treat you from this condition first. Of course, I appreciate the concern, the worry. Okay. So this is another concern, the TB, HIV, hepatitis B and C to be screened before starting this medication. The second or the third point, one of the point also Dr. Al Huda mentioned, reaction. While giving you this medication through your blood channel, don't say IV drip. Yes, it's a drip, but it's not IV. What the meaning of IV? It's the jargon. So it's a drip through your blood channel easily. Okay, it's drip. Yes, it's drip,
Okay.
but through the blood channel. Whenever you receive it for the first time, you might have a reaction. In order to prevent that, we have to admit you to receive this medication. Anyway, every dose of rituximab should be received at hospital. You should be aware about that, okay? It's not only the first dose. Every dose should be received at hospital. This is one of the medication should be received at the hospital. Sometimes it has bradycardia, hypotension, reaction, skin reaction. Any reaction might happen, so you can explain it as allergic one, and it should be immediately managed and monitored by the follow-up doctors. The next point, we already mentioned the reaction. The next thing will be the other side effect. What do you think other side effect? We mentioned already the skin reaction, reactivation of some infections. I think this is the most important side effect for any biological therapy. You have to mention it in any communication scenario. Apart from this, the way the dose will be detected by the pharmacist. The frequency would be also through the blood channel we mentioned. The frequency, it might be every couple of months. What I know, it's every 6 months. If you don't know, so we give you the first dose and we will let you know when will be the next dose, either after 3 months or whatever. Don't give him or don't specify a duration. It would be after assessment. If you are responding to this medication, we gonna give you the next dose. If you don't know, but what I know, it's every 6 hours. Sorry, every 6 weeks. No, not 6 weeks. Every 6 months. Sorry, 6 months. Okay, so it's every 6 months. Anyway, this is regarding the duration, sorry, the frequency, the dosage, and the route. And previously, we already explained the way or the mechanism of action. I'm telling about how to explain a medication or how to counsel about medication. You have to start about the name of the medication, the mechanism of action, the route, the dose, the frequency, possible side effect, and the red flag at the end. Okay, the side effects we already mentioned. The red flag, as I told you, you have to give her red flag at the end, at the last minute. Please, if you feel unwell after you leave the hospital, after you discharge home, sometimes there is delayed reaction, right? So if you feel unwell, if you feel high body temperature, please don't hesitate to call us. I will give you the unit contact number. Don't say to call my number. I will give you my number, not your contact number. Okay? It's not allowed to say I will give you my contact number. They consider it as wrong. So I will give you the unit contact number. You can call us immediately or seek medical advice or come to the emergency immediately. Who's living with you? Do you smoke? Do you drink alcohol? What's your job? You didn't ask about the job. And although she mentioned to you her job, she said, I don't remember what she mentioned. Dr. Ayula, what you said about the job? You mentioned earlier.
I work in a shop as a shop
Yeah,
retailer.
sure. Perfect. Yeah. She was working in the shop. So it's very important. And she mentioned to you, Doctor, I cannot cope with my job. You have to address it later on. I'm so sorry for your suffering. I know it's very difficult for you to do such job with this disease. It's shop means she's using her hands, her joints frequently, and you didn't address it. So at least refer her to the occupational worker. They can reallocate her, or they can arrange with her coordinator to change the position or whatsoever. It's not our job. Just refer her and be sorry for her suffering because this is her job. Don't say if you are financially supported. Don't ask about financial support. It's not preferred to ask about. The support they need is the daily activity support, the social support, the job support, occupational support, but never ever offer financial support. Okay. One more concern, the last one, about the cost of the medication. I think in UK, and this is also for PACES exam purpose, the services there, the health services there is provided for everyone, right, Dr. Ayola? So whenever the medication is expensive or cheap, it would be provided by the health care team. So you can, if she's worried about, don't worry about this. We are caring about the response to this medication. Okay, so don't worry about the price and is it expensive. We even if it is expensive, we care about your response. If you're responding to this medication, so we'll try to find a way to give you this medication. I think it's free, but if she's concerning like that, you can say we will find a way to give you this medication freely. Okay,
Okay.
Dr. Ayula, I will ask you because you are in UK. How is the medication given according to the cost?
Yeah, it's available for all.
Yeah,
Once there is indication for it, is available for all.
exactly. So once you are candidate for this medication, so it would be provided for you. Don't worry about the price. Is it expensive or no? Okay.
Okay.
So this is the
Okay.
last
Doctor,
concern.
what's about
Yeah, go ahead.
sorry, what about the consent of the medication?
Yes,
No need.
thank you for reminding. No
She
need, of
agreed.
course. No, 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 no. It's need. One of the medication should be consented verbally and written, the biological therapy as well as chemotherapy. Remember this. Other medication patient can be received without consent. I mean antibiotics, or because it's including in the general consent in the emergency. There is what's called general consent, right? So the patient is agreed to receive the medication in the best interest of her condition. Biological therapy and chemotherapy, one of the medication carrying a lot of side effects. It might affect even the life, right? The patient might have either serious infection or cancer or anything else reaction, and he will blame you. You give me this medication particularly without consent. I didn't accept this medication because you are explaining a medication, right? So in
Okay.
the general medication or in the general admission medication, no need for consent. But such medication should be consented. At least if you will not provide here a consent form, written consent form. You can provide agree verbally. Okay, you can ask her, what do you think, Mrs. Battle, about our medication today? Are you agreed to go ahead with this medication? Yes, doctor, I think it's good. No, doctor, I should read about it more. No, doctor, I should think about it. Any of them, but you at least you ask the acceptance verbally, or at least verbally. But the optimum here, I will give you a consent form. You read about it, the possible side effect. Whenever you agree, please sign it. Clear?
Okay,
Okay, thank you,
clear.
Dr. Huda.
Thank you.
Yeah, thank you to be participant today. It's really good to do this practice, and you will know the difference later on. You will gain a lot of confidence whenever you are practicing. Okay. The
Thank
point
you.
of pregnancy. Thank you, Dr. Al-Ghada. Dr. Ayula, I will try to finish the comments, and anyone has comment, he can comment. The point of pregnancy and lactation, I agree to mention them whenever you have female in the childbearing age. Please remember, any patient from 14 or from 15 till 50 or 45 in this age, during the exam, at any station, write in your paper pregnancy in a big circle, as well as the lactation or the birth control pills. Okay, be sure it would be a hidden agenda. There is something will be hidden if you raise this issue with her, the pregnancy or birth control pills. Thank you, Dr. Hida, for the remind. Check the blood. Yeah, Dr. Hida, I thought wrote check your blood cell count. So this is one of the tests should be done. We have to do basic workup and some specific investigation for bugs for your defense system. Okay, so it's one of the basic investigation should be done. Particularly, you can say cell count to know your defense system status. It's okay, but it's not particularly something to be mentioned because anyone or every patient before taking indication, he should undergo this blood test
as an instruction يعني doctor
as instruction.
because lowering all CBC.
Ah, okay. So it's you mean later on as a follow up and monitor. Okay, so at the baseline we will do it for the frequent monitoring later on. We will check if your blood count is okay, stable, or any change. Okay, this is what you mean. Not at the initially, it's for follow up, but always we are doing the initial test as baseline. Because whenever I will give the medication in the next dose, I should check how much the hemoglobin now, how much I should check how much the platelet, how much the white blood cells in comparison with the baseline. Dr. Ilaf asked, in general, any tips and tricks in case of scenario was about drug, but we can not remember the details about. Any tips? You mean book, right, Dr. Ilaf? You mean book or something you read about? It's for me, the practice always give you this information because you will hear this scenario from this doctor. Next day you will hear it from other doctor and write for every scenario how to remember what medication and what I should ask in this medication. But in general, be sure even you have a medication you don't read it about it before in your exam. They brought for you X medication. Just follow the scheme I put in the video. There is short video about how to counsel about a medication. Simply start to ask about the background as any introduction. What's your opinion about this medication? What's your background? What do you think about this meeting? What do you think about this medication? She will give you some concern or she will ask you one question. If she asks, address it initially first, okay? Then start to talk about the medication in the same order I will mention now. The first thing, the medication name. Don't forget to say the medication name. Because you might say it's a medication given to the condition, but you didn't say the medication name. Okay, so in this scenario, I think Dr. Ayala mentioned at least once Rituximab. It's called rituximab, biological therapy. Have you ever heard about it? No, doctor. So you can start now defining the medication. It's one of the medication, the mechanism of action, acting by whatever the medication mechanism of action. So medication X act as decrease or modulate the defense system. This is the first thing, the mechanism of action. The second thing, you will receive this medication through your mouth. So the route, right? I will give you this medication orally. I will give it IV drip, or I will give it under the skin or intramuscular, whatever. Then the frequency, you will receive this medication in daily basis, once daily or twice daily, whatever. Again, if you know and written in the scenario, do it. If you don't know, you can say, I will give you more details about this medication in the next meeting. Be smart. Don't say wrong dose. Don't say wrong frequency. The next thing, the frequency, we mentioned the dosage, how much. For example, apixaban. You will receive apixaban 5 milligram BID. It should be written in the scenario. So we started about the scenario from explaining the mechanism of action, the name of the medication, the explain of mechanism of action, the frequency, the dosage, and the duration, and the route. The duration, the route already mentioned, the duration. You receive this medication lifelong. You receive this medication for 3 months for provoked PE, for example. Whenever the duration, either mentioned or no, if not mentioned, you can start this medication shortly, and we will sit with you to know till when or till what date you can receive this medication after assessment. So we mentioned the duration, frequency, dosage, and route. Now the time for the side effect. Every medication, as you know, every medication has the side effect and the benefit. We always weigh the risk and benefit. Whenever the benefit outweigh the risk, we prescribe this medication in the best interest of your condition. And as every medication having a side effect, you have to know the possible side effect. Simply, any medication through IV, you can say it can lead to reaction. Okay, this reaction by IV would be more severe than the oral. Oral also had reaction. You can say there is reaction, feeling feeling dizzy, feeling throwing up, or feeling sick or throwing up. Any medication can lead to this, right? Which we know from any antibiotic, either GI upset, either feeling sick or throwing up. Any side effect specific for this medication, you have to mention. Like in this scenario, decrease immunity so you can get infection. In another scenario, for example, methotrexate, you might have lung fibrosis, you might have liver function derangement. It's specific for methotrexate. Another medication, for example, let's say steroid. Steroid, I think everyone knows about the steroid side effect from A to Z. So you can give the commonest, or if you don't remember, mention the most important and the most serious. Okay, but be sure there is side effect related to each medication. Maybe it would be specific, you have to mention. Let's talk about fingolimod. We mentioned this in another sessions. Fingolimod, for example, one of the most important side effects of fingolimod is bradycardia. Patient should be admitted and monitored for heart rate. In the same way, every medication, at least you have to know, and you should know from your background as medicine, the most important and specific side effect to this medication. Add to this allergy for any medication newly administered to the patient. Okay, so the side effect already mentioned, or the complication, and always reassure the patient, we will be following up you, we will be monitoring you, either by outpatient clinic appointment or some blood test follow up. Even if you are at home, if you feel unwell, this is the red flags and safety netting. And this is the end and the closure of the medication counseling. If you have feeling unwell, high body temperature, you feel sick, you cannot tolerate the feeling of throwing up, please visit us. This is in general. You can mention some specific side effect might happen at home. You can address it by saying visit us. If you feel sore throat, for example, patient have sore throat while he's taking immunosuppressant and it's not responding, he's coughing frequently for Rituximab, for example, short of breath, any possible side effect specific to medication, and you find it might affect his life, give him instruction to visit the emergency immediately whenever he feel it. See, it's not something difficult or something impossible. Okay, you can do any station by this scheme. At the end, of course, you have to offer the support with whom you're living, the job, pregnancy, or OCP or birth control pills, and the job, of course, as I mentioned. Is it clear for all? I hope it's clear, Dr. Ilab. Okay, someone wrote Dr. Ihda, every 2 weeks. No, I remember it's every 6 months. 1 gram IV infusion separated by 2 weeks every 6 months. Okay, this is the dose. At least they will mention it in the scenario. If not mentioned and you are not sure, of course, don't give any number. So we will sit with you in another meeting to give you informations about the dosage if you are not sure, the route if you don't know, the frequency, the duration, any question you don't know, and it put you at trouble to answer wrong, don't answer it in wrong way. Give him another meeting and give him more information in the next meeting. It's not wrong answer. I hope it's clear, Dr. Ilaf. See, yes. Drug usually come in communication. Insulin, steroid, warfarin, what else? No, it's a big list. Not only that. Methotrexate, write down. Methotrexate, fungilimod. Our medication today, monoclonal or biological therapy, new oral anticoagulant. Yes, it's big list. Okay, so any participant should practice about at least the commonest medication, and by our scheme, you can do any medication. Any questions? Anyone has raised concern? Any doubt? Fungal mode, write down. Fungal mode. Biological is a big term and big umbrella for many medication can be used. Okay. Anti-TB, yes, sometimes. Anti-TB, but it comes with TB, not as anti-TB only. So it comes in combination with TB explanation. So explain the TB and the possible medication and side effect. Insulin, we mentioned already the insulin. Sometimes they give you combination of medication. Patient is suffering of ischemic heart disease, diabetic hypertension, dyslipidemia. So you have to explain about atorvastatin, lipid-lowering therapy, about aspirin, about antihypertensive. Be ready to give them about every medication, one information, and it should be something important. Yes, of course, there is a list in Telegram group. Okay. We can share it from the WhatsApp group. Remind me, Dr. Ilaf, I will send you some medication list came in basis. Okay, just remind me privately message.
You send it to the right.
Sorry, Dr. Ayula?
I mean, are you sending that to the group?
Yeah, I will send this list to the
To
group.
the group. Okay, not personal. Okay, thank you.
Yeah, I ask her to remind me personal. Then I
Okay,
will
all
send it to the group. Not I
Oh.
will send her privately. I will send it to the group, of course.
Okay, all right. Thank you.
Most welcome. Okay, thank you. Thank you, Dr. Ayula. Thank you, Dr. Ilaf. Thank you, Dr. Al-Huda. Any question before ending the session? Okay, see you tomorrow with the long clinical consultation day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you.